Have the next speaker, Dr. Kirti Rani. Evolution of corneal endothelial cell loss following vitrectomy with different endotamponades.
Good afternoon, everyone. And myself, Dr. Kirti Rani, and today I will be presenting paper on topic evaluation of corneal endothelial cell loss following vitrectomy with different endotamponades. Coming to the introduction, as a vitreoretinal surgeon, we should not neglect the cornea, which is very vital structure responsible for the good functional outcome after a good retinal surgery. In past, there are only few studies documenting endothelial cell damage following vitreoretinal surgery, and none of them has been conducted on Indian eyes. So this knowledge gap necessitates the further investigation. These are various factors which are responsible for the endothelial cell damage during vitrectomy, and out of these factors, endotamponating agent is a very important factor. Aims and objective were to evaluate corneal endothelial cell loss following vitrectomy with different endotamponades in eyes of Indian cohort. This was a retrospective, non-randomized, comparative observational study which was conducted in between Jan 22 to March 23, and after taking informed consent from participant and approval from the ethics committee. Inclusion criteria include age more than 20 years, phakic patient, should a phakic patient with history of cataract surgery more than 6 months, with endothelial cell count more than 1900 cells per millimeter square and willing to participate in the study. Exclusion criteria include pre-existing corneal abnormality, ocular inflammation, trauma, glaucoma, aphakia, zonular dehiscence, complicated RD, and history of multiple retinal surgery. Total 32 patients were enrolled in the study, and they were divided into 3 groups. Group A include patient with C3-F gas injection, Group B include patient with silicone oil injection, and Group C include patient with ringer lactate at the end of the surgery. After a thorough ophthalmic examination, a non-contact specular microscope was carried out in all patients with the help of Topcon SP3000P version. And these various endothelial cell parameters like endothelial cell density, average cell area, coefficient of variation, central corneal thickness, and hexagonality was seen in all the patients. And minimum 50 cells were counted, which is ideal for looking for the endothelial cell loss in this patient. During the follow-up period, the non-contact specular microscopy was performed by same machine at 1 month and 3 month follow-up. And coming to the result part, a significant endothelial cell density loss was seen on all the 3 groups, and maximum reduction was seen in silicone oil group. Minimum was seen in patient in which C3-F gas was injected. This particular table is showing that post-operative 3-month follow-up data, and in this we can see a significant difference in the changes in endothelial cell density and the central corneal thickness. However, the difference in rest of the parameters was not significant in between the 3 groups. Coming to the discussion part, endotamponing agent, we all know that have a very important role in the reattachment of retina. However, these agents may simultaneously damage the corneal endothelium, leading to the development of corneal decompensation and ultimately poor visual outcome. In past studies, in one of the study by the Goni et al., they have seen significant decrease in the number of cell density in the cornea. However, no difference was seen in the hexagonality and CV. In another study by the Farai et al., they have seen that silicone oil filled eye exhibited a lower endothelial cell density and a higher CV and reduction in hexagonality. In a study by Sinar et al., they have noted any significant difference in the eyes with SF6 or silicone oil endotamponating agent. In a study by Common et al., they have seen significant reduction in these parameters, and in their study, the gas tamponade has a superior outcome.
That's what surgery.
In another study by Abraham et al., in which they compared silicone oil with ringer lactate, significant endothelial cell density was seen, loss seen in both the groups. In our study, C3-F gas injection has lowest percentage of endothelial cell loss, and silicone oil group has exhibited higher percentage of endothelial cell loss, and these findings are consistent with few of the previous studies. Limitations of our study include short term of follow-up of only 3 months, small sample size, use of ringer lactate instead of BSS, irrigation fluid volume was not measured, and surgical time was not same for different groups. The strength of the study include all the surgeries are performed by same surgeon, same center. Age was matched in patient of different groups. All measurements were captured by same examiner who counted minimum of 50 cells, which is ideal for accurate measurement. Coming to the conclusion, corneal endothelial cell loss after vascular vitrectomy with different endotamponades is a very crucial consideration in vitreoretinal surgery, and we as surgeons must carefully weigh the benefits and risk of different endotamponades during the vascular vitrectomy to achieve the good visual outcome. This study add data from the Indian population which was not studied before, and this is the further future research direction that we should develop a novel endotamponade with less toxicity on the cornea, hence improved corneal outcome. Thank you everyone.
Any specific reason why RL was chosen versus BSS, which is more endothelium friendly?
Sir, might be in this study possible that the patient in which the ringer lactate was used, they are usually diabetic patients. So might be the duration of surgery was more in these patients as compared to the patient with silicone oil. So we usually left, in diabetic vitrectomy, there is no development of hole during the surgery, then we left the patient under ringer lactate only. So I think that's might be one of the reason, as most patients are diabetic in that group.
And you didn't mention the area of you did manually check, counted 50 cells, right?
Yes, sir.
So what was the central zone you counted? How
So
many
we
millimeters?
counted in the central 3 millimeter area.
Okay.
So just maybe I missed out, what was the lens status in all your, this thing was uniform? Lens status, they were
No,
affected?
no, sir. Sir, some patients were phakic, some were pseudophakic, and if they are pseudophakic, then the duration of the cataract surgery should be at least 6 months. And in studies, sir, we have also compared between phakic and pseudophakic patients. And because of that time lag, I have not included that particular data. But in our study, we have seen that whether the patient is phakic or pseudophakic, the difference between these two groups was not significant.
And none of the patient, the oil or gas migrated into the anterior chamber?
No, sir.
Because sometimes even in pseudophakic, if the zonules are weak, you can have a small bubble of oil or gas escaping into.
Yes, sir.
So you had no patient with this
No, sir.
escape? Okay.
Okay. Thank you, sir. Thank you.